everybody. Welcome to our season finale of the podcast. I'm Lindsay Renzullo.
I'm Krista Bernalican.
And we are here on site at the brand new Bulger Veterinary Hospital, which is super exciting because we thought that this episode we would give our clients, our viewers, a sneak peek in the new hospital to kind of get you acclimated to what we're going to be.
Don't come here yet. We're not open. We're not going to be open until the middle of the last week of June, so June 27th. So don't come here right now, but we're going to show you everything that's going on. There's still a lot of construction going on, so bear with us, but we'll show you the entire hospital.
Yeah. All right, so off we go into the main lobby. Come follow us. So this will be the entrance into the main lobby. And what's different about this hospital compared to our last hospital is that we obviously have just now one entrance. Whereas before we had the ER side and the sort of regular general practice specialty side. Now we have one entrance for everybody, which is great.
So come on through here.
And this is the new lobby. I mean, it's just absolutely gorgeous. So obviously it's still under construction. We're still not moved in yet. There's lots of work that's still being done, lots of finishing touches. But the lobby itself is breathtaking. It's really nice. So there's actually a few different areas to the lobby. Krista, do you want to sort of talk about the different sections?
Sure. So when you come in, you're going to be checking in here at the front desk, which obviously is not completed yet. We'll have your receptionist that you know and love here to meet you and greet you when you arrive. Our lobby is divided into a few main areas here, so we're trying our best to keep the pets separated so that they're not stressed out and so that we don't have any interactions between pets. So we have multiple little seating areas here. Over at the far end of the lobby, we'll walk over this way. We have an area that's meant to be for you to wait for longer term waiting. So you're waiting for your pet's diagnostics or blood work to be run, so you're going to do that. Over here, we have a nice fireplace and TV set up, but again, just multiple areas for you to choose from where to sit.
I was like, fireplace. This will be a really quiet area. I kind of like how it's separated from the main lobby. There'll be a lot of hustle and bustle that's sort of going on out there, so having clients have a place to sort of sit and wait when they are waiting for their patients that are, in a procedure or, in an emergency is a nice option for clients.
Grab a cup of coffee and come over here. So we do have a little area here set aside for our cat patients and owners to be away from the hustle and bustle of dogs and those little noses that like to sniff in the carriers. And then we have a few exam rooms that exit directly off of there to keep the cats just completely isolated.
So off of the waiting area, we have this corridor here that leads to all the specialty departments. And so we're going to show you an exam room of one specialty department just to kind of have you have a feel of what to expect. I think we'll do this one. This will be dermatology, right? Or
this is exotics. So
right?
Every room is very similar, but each one has its own little special charms. But we tried to have natural light throughout, so again, that's less stressful for animals and for people. Every room has folding exam tables and nice seating built in for clients, and I think that's about it.
Let's see if these are these functional yet?
Yeah, just
we can show them. So it's kind of nice because it doesn't make a loud noise.
Right.
You're able to sort of bring up the exam table if you have a larger patient, and these are in all of the exam rooms, which is really, really nice.
Yep. Lovely. So heading back this way then, you're going to have many more exam rooms. This is a big feature of this particular building is that one of the struggles that we've had has been not having an appropriate exam room space for you. And so frequently you've come to our hospital and had to wait a little bit until we found an exam room, or sometimes we had to bring you back to the ER area. So this hospital has many more exam rooms than you had at our previous hospital.
Yeah, we could say. This is sort of a sad. Yeah. Oh, it is very echoey. Maybe we'll stay outside here when we talk about it. So this room is really a very beautiful room. It has a very nice cathedral ceiling. It's got nice lighting, and we're going to be furnished with really comfortable furniture to kind of make it a really homey feel. But this will be our bereavement room. So unfortunately, we obviously have cases that, people need to be able to put their pet down in a peaceful, quiet place. And this room will be a really nice place, a really nice area that they can do that. And they'll also have a private exit, so they do not need to come back through the main portion of the hospital after their pet has passed. And this room here really marks the end of exam rooms for the specialty sort of side. Starting here, this door will be closed. This will be team members only, and we'll show you what's sort of behind closed doors. This is the extra cool stuff for the clients to see, the kind of sneak peek behind the scenes.
So now as we walk to behind the scenes, it might be a little noisy because we have a lot of people here doing work, but this is where we enter into our main kind of hub, the treatment area, and where most of the diagnostics and little mini treatments are performed. So let's walk this way.
These cages here will be for the specialty departments to be able to place patients in.
Or emergency.
Or emergency, it's true, yep. If they need to be able to have some tests done, if some blood work needs to get drawn, or they need an x-ray, it's just a great place for them to sort of put those patients temporarily while they're waiting for those tests.
Oh, guess what you get to do? You can come over one day, maybe bring your children.
Guess what you get to do? Be on the podcast.
Hello, you're on the podcast, Steve.
All the paper has to be removed from the new wet sinks, and you love to do
I
that.
love to do that. This is Steve
pulling it up.
Isherwood, who's our hospital director, who has orchestrated most of this
really cool.
hospital building.
We're very excited because I have cage covers.
Oh,
Yeah.
nice.
Privacy covers.
So as we walk back this way, this is our main treatment area, and you can see that it's, again, nice and bright with lots of natural light, again, to hopefully decrease stress for patients and our colleagues. So when your pet comes back, a lot of the time there's a lot of mystery to what happens out back. Usually it's just because we need to draw blood or do x-rays or do something that we really can't do in an exam room. And so this is where your pet's going to be treated in those situations, through ER or over here through general practice. We'll show you. But these tables are designed to be a place where your pet can sit while we draw blood or examine them or do any of those other diagnostic tests. So we have many more spaces here than we did previously. Previously we were kind of very limited in the number of pets we could treat simultaneously, but now we have much more space.
And right off of it, which is really nice, we have these big open windows, and behind there will be offices for a lot of our specialists. So they'll be right off of the main floor, be able to have an easy, accessible place for us to still be able to talk to them.
And to be able to see the patients they're treating.
And I think one of the things about Bulger that we all loved is we all felt so close to each other, right? So Bulger, because just space-wise, we all were on top of each other. This way, I sort of feel like the open concept is making us still feel that way by giving us more space.
So this is our lab area. So when we do diagnostic tests, a lot of those, you might be surprised to know, are actually run on site at our hospital by our technical staff. And so we'll run.
That's Steve. Steve has been a huge help in sort of building Bulger. Say hi to the podcast, Steve.
Hi, everybody.
What's your official title, Steve?
Construction supervisor.
Construction supervisor. So he's been supervising this entire project. And a little known fact, he was actually integral in a lot of renovations that happened at the old Bulger building.
I didn't even know that, Steve. How
There's
funny.
there's a picture on
On
the
the roof.
website of me on the roof from 30-something years ago.
Oh, wow. That's
Yep.
great. And he is the husband to one of our wonderful client care coordinators. So
All in the family.
Yeah, it's all in the family. It's great. Thanks, Steve.
No problem.
So this is our lab area. So we do our diagnostic testing here. Lab samples wait here for the outside labs to pick up, and various different, things that we do.
It's nice, and it's very close to that
cut
treatment
that
area.
So here we're in what we call a mini treatment area. So our intention here is that our general practice doctors who are coming from their exam rooms are going to be able to bring their pets directly here and not have to go to the main ER treatment area when that's a little bit crazy, or into the ICU to have things done. So have a little bit of a home base that's separate and has more of the things that we do on a regular basis. So this is our GP treatment area. We have TV screens you may see all over the place because we follow most of our cases electronically throughout the course of their stay here in the hospital with little check boxes and little
Flag markers.
flag markers.
Yeah. So this is a nice area. I mean, this is a difference from right now currently at Bulger. We sort of all share this one ER general practice specialties treatment area. So this is really
And
able
the kitchen.
And the kitchen. So this is really being able to give us a little bit of privacy for those patients and have the workflow be much better.
Yep. Travel over here into the ICU. So one thing that was really important to us as designing this building was that we had an ICU that was a little bit quieter and a little bit more separate. ICU patients are very sick and they need a less stressful environment, and sometimes the hustle and bustle of that ER area with the treatments and all the cages surrounding it and healthy dogs barking, it's just not conducive to them getting better as quickly as we would like. So we have our separate little ICU here. We have multiple oxygen cages for the pets that might need oxygen. We have many more dog runs than we ever previously had, and those are not in yet, of course. And then a couple of procedure tables as well, so that we can do some sedated wound repairs and kinds of things like that in this room.
This is one of my favorite areas. I love this. So this is going to be the dog walk area for all of our patients. We come back here. I love this little vestibule, especially if like
in the winter.
In the winter time. I mean, it's going to be a great place for the technicians to put their jackets on, coats on, and then to be able to exit out here. It's fully fenced in, which is great, but it has this wonderful artificial turf, which can be hosed down and cleaned up really well. It has a great drainage system underneath it. And so it's able to be a really pretty spot for the technicians to walk the patients, for the patients to get outside for a little bit, get some fresh air.
And we have a lot of patients that they won't like go potty on the mulch or the rocks, and we just think they're gonna really appreciate this spot.
We do, and we have a couple of substrates. I mean, we not only have this, kind of grass-like area, but we do have some trees if they need to,
Lift
for
a
those
little
boys'
leg.
dogs, lifting those legs, it's important. So being able to have access to all of that. And it's a really pretty spot. I like this area.
And the part of this area, which the fence has not gone up yet, will be an area that you as clients can come and walk your dog prior to or after an appointment. So that again, you have a nice, safe, fenced-in area for your dog. So now we're going to head to the alternate entrance to the outside, which is the ward. So these are just different hospitalization areas depending upon the severity of the pet's issue.
So the wards tend to be not as critical patients, so the patients that are a little bit more stable can go on to the wards.
Healthy pets come in for spay or neuter procedures like that.
Yeah. My favorite part of this part is right over here, actually. And it might not be as glamorous to the clients, but it's actually a stand-up shower. So we do have a lot of dogs that can get quite messy at times, or if they're not feeling so well, they might have an accident on themselves. And so this is a great way to have a big dog stand up and have us give them a bath without sort of having to put them up into a table, which is all we have right now. But being able to have this portable shower unit, which I have for my children.
Do not spray me.
It works great. Can you imagine?
I know.
Yeah.
So again, following through here, we have a few little different hospitalization areas for different species that might need different kinds of care. So over here, we have it's relatively small, but a little area to hospitalize some of the exotic species, especially birds that really just do not appreciate other patients being around. So this is not outfit yet with cages, but that will have some specific reptile and avian cages. And then finally, our cats also are special needs in terms of their stress levels. So we do have a separate cat ward, which we never ever had before. We just had to have the pets hospitalized near each other. We tried to put cats not near any loud dogs, but this way they will have their own separate space.
Yeah, it makes a huge difference. It's hard when you have a barking dog, so having it enclosed in, but lots of windows, being able to see all the patients is going to be great.
Yeah.
All right, so we're back in the wards again where we just were, and we're going out this way, kind of towards that main ER treatment area. And this leads us into surgery prep and the surgery area. So the surgery area is a huge upgrade. It's going to be really exciting. Surgery prep is going to be right here, which means that we're getting the patients like anesthetized, getting ready for surgery, getting ready to be brought into the surgical suites. And from here, we're really able to have, great eyes or great monitoring on kind of all those patients as they're moving through.
And it allows us to keep the surgery area as clean as it should be, because we do most of the shaving and the getting any dirt off of the animals before we move into the surgery area.
Yeah. So from that surgery prep area, we're going to have patients that are, if they're big enough, they'll be on gurneys. If they're small enough, we can just sort of carry them abroad right from this prep right into the surgery department. And so in here, down this hallway, are going to be our surgical suites we'll go into. But this is actually a really exciting area too. This is going to be the area where all of the surgical packs are basically packaged up, cleaned, and basically kept in this sterile environment, which is going to be really, really exciting, and making a huge difference from where we are right now.
So we do our surgery, we scrub up, and we go. And now we move into the surgery suite. So each suite has very similar setup. So surgery suites right now do not have any tables or anything. Some of them have tables. They all have their lights. Each suite is going to be outfit exactly the same way as our suites are currently, but with excellent monitoring and new anesthesia machines, but with enough space to really move around and do a great job.
Yeah. And I mean, we have great surgical lighting right now, but I think that the actual overhead lighting and the natural lighting that this current setup it's unparalleled. I mean, the way it is now, the Bulger surgery suite is in the middle of the hospital, which is cool because I mean, the surgery suite is sort of in the center of everything. But as far as
that skylight we have, though.
That is true.
We have a skylight in our surgery.
I think the skylight goes to the attic.
It's weird.
Into the attic. It's really weird. But this is actually going to be really nice. These lights and having all the windows open to the surgery area
What
will
I
be
like,
really nice.
Lindsay, is that while I'm doing surgery and you're doing surgery right there, I can be here doing my surgery and I can go, "Hi, Lindsay."
But I'm here. Hang on. So there's 5 surgical suites, which is great down this hallway. The one in the furthest end is where our board surgeon, Dr. Blazer, will be doing the most of her surgeries.
Most of orthopedic.
Yeah. So it's a big room
It's
to kind of
gigantic.
accommodate for her equipment that she needs, which is really
too
very
big.
nice. It's too big.
It's too big.
It is very nice though. It's very
So
nice.
a lot of her equipment is large and does involve the scoping tower, and there's just a lot of bulk to it. So that's why the suite is particularly large.
So back to kind of acclimate you where you're at. This is the main ER area.
We can start over. Go ahead. That's fine.
And so from that, we had our wards and the general practice, but now we're going this way. And here is our internal medicine department.
Procedure area. So internal medicine does anesthetized procedures that are usually scopes. So they take a little tiny camera and they go down different places in your pet or up. And this is where they'll be doing that. It's also very close to the surgery area, so our anesthesiologist can monitor simultaneously both types of things. It's also close to ultrasound, which they utilize. We tried to think about where, the different animals would be flowing throughout the hospital.
Yeah.
This is X-ray. X-ray is a very commonly done procedure for our patients, probably like 20% of them come in and have some form of X-ray done. So again, kind of close to the ER, also close to the other X-ray sorts of modalities.
Yeah. This is super exciting. So Bulger's been waiting a very long time for this, and we just haven't been able to have the space for it. And so we got, in the brand new building, a CT scanner. So we have been waiting for this CT. I can't even tell you the countless times that we would say, if we just had a CT.
We measured some rooms. We were like, maybe we could get this tiny little CT and we could squeeze it into this room, and maybe we could renovate and bust out this door.
Oh, we wanted one so badly.
Yeah.
It's just such an important modality to really be sort of one of the leaders in veterinary medicine. So having the CT scanner is awesome. So we have one.
How many times do you go, oh, if I only had CT?
All the
just do
time.
this.
Yeah. I mean, you're talking about, this is good for anything from,
Noses,
visualizing, like the skull, which is super hard to really analyze appropriately with an X-ray.
Chest.
Yeah, to acute injuries, like an emergency case comes in. Yeah, CT is where it's at. So we have one now. So this is super exciting. So come on in and take a look.
And the big thing about this CT is that it's a fast unit, and so that means that we don't necessarily have to fully anesthetize every single pet that we are treating. Some of them can just be sedated. Some little bunnies even can just be run through it without any sedation at all, just in a little clear box. So it's very exciting.
We'll have basically a controlling station. So we'll have our technician out here, and it's great because it has a window that goes right through, so you can be able to see the patient in there. It's just exciting. Super great.
This room, which is also empty, it will house our ultrasound. So we do ultrasounds in very dark rooms that have the ability to turn the lights off completely, and that's what is special about this room, is it actually has no natural light.
Mm-hmm. Laundry is actually exciting, I feel like, for a lot of our technicians. This is another one of those shower moments where I love the stand-up shower.
Where
the
you
technicians
guys
are going to love it.
As owners are going to be like, they showed me a shower.
Yeah, but you know what? And then show me laundry room. The laundry room, honestly, is so cool because now we have this whole big room where we can fold all of the stuff. We're not in the middle of the dental area. It's going to be great.
Laundry is actually a unsung hero in the care of animals, really, because every single patient that is hospitalized is on blankets and towels to keep them comfortable, and then they invariably, make messes and pee and poop or whatever, and we change those beds sometimes every 4 to 8 hours.
Yep.
And so there's just a tremendous amount of laundry that gets generated. So.
All right, for all our progressive clients, and I am definitely one of them, is we have a dedicated room for all of our doctors and technicians and client care, any staff member that is currently nursing at home and wants a quiet place to pump. So we have a dedicated mom's room that we're going to really decorate, make it really comfy and cozy. We'll have a little fridge in there. I have the idea.
Oh.
I have a couple stuff for my kids. I'm all done with the nursery. I'm going to bring it up here so it will look kind of
mommy-ish?
homey and mommy-ish.
Oh.
Yeah.
That's very nice.
It'll look cute. So we'll make it nice and comfy and cozy, and there's a sink in there and everything. So go moms.
Perfect. So this is my favorite room because you know how much I love dentistry, and Lindsay does too.
I do too.
So this is our dental suite. So we have now the ability to do 2 procedures at a time, and we've kind of decked it out, to be honest, like with the things that make it more ergonomic and more just efficient to do your dentistries. So most of the dental equipment's not in here yet, but the tables are, and they're very exciting because they're hydraulic and they go up and down. These are just things that make it easier to do a dental procedure. That means it's faster for your pet while they're under. It means that we don't get as frustrated, and we just can have a much smoother process. And everything you want for your pet while they're under anesthesia should be smooth.
Yeah, definitely. And the light in here too. I mean, again, going back to the natural light, but that's really awesome. And just the workflow, the way in which the tables are positioned, the way in which we're going to be sitting when we do the dentals will be a much better workflow for all of us.
Or standing. We have many doctors that want to be able to sit or stand or whatever, and that's just not an option.
Yeah, this would be great.
Hospital.
So this is actually going to be where we're going to have the podcast when we move to the new building. This little common meeting area is going to be a place where all sort of our leadership in the hospital can be able to sit and congregate and talk and have private meetings. But off of this is each sort of an own private office for each one of those managers or those supervisors.
Well, it's not private because you and I share an office.
We're going to share. But this will be where the podcast will be, which will be kind of exciting.
Did I tell you I'm getting hamsters now? Here we are in a not very glamorous but incredibly important part of the hospital as well. So this is our loading dock and our stock room. So as you can see, there's shelving set up. We need to be able to to stock enough supplies so that we have everything at any moment, and also have a little extra so we never run out. And so this is where that will be. So we're back here in the treatment area, and so again, a lot of things branch off from the treatment area. So we're going to walk upstairs to the doctor's office area, which is the mezzanine. So it's kind of an open space. So this is our doctor's office space. So again, maybe not very glamorous, but it is really nice for our doctors to have a place where they can think, where they can write up records, where they can call clients anytime they need to, and just have a space that they can go to that's a little bit away from the clinical floor.
Yeah.
How do you feel about it?
I love it though. I love it because you're able to still sort of look down. This is sort of a great setup in my mind.
So Lindsay could come up here and yell down and be like, hey, I need you to draw some blood.
Yeah. It's much bigger than what we currently have, and the way that it's sort of set up makes it feel really special up here. I don't know. I feel special up here. It's nice. And it does give the doctors a little bit of privacy, which I think that is really important, especially if they're making some important phone calls. So I do like it, having this quiet spot up here. Yep. Back in the GP area, the GP treatment area, we're still on the employee side, so this is still behind the scenes. Back here is where we'll have the technicians and client care be able to have their personal belongings get locked up or put their stuff in for the day. Mailboxes. And then this is a really cool new thing that we have. I mean, we have currently a kitchen that was there with the original Bulger house that was built long time ago. We did paint it a couple of coats ago. But now this is going to be our brand new kitchen, cafeteria break area for the employees, which is nice. And we'll have a couple of like live vending machines here, which will be having fresh food sort of delivered daily for them to be able to pick out something if they want. But it's a really cool spot and gives you a really good look outside.
So finally, now we showed you the specialty exam room area, and now we're going to walk through the general practice and ER exam room areas. So again, this is our door to the back versus the front. So the front part you'll see all the time when you come in for your appointments.
Yeah. All the exam rooms have a little bit of differences to them, but for the most part, they're still the same. So we still have those drop-down tables, which is really nice. You know, a lot of times we won't use the big table. If we have a big dog, we're going to be flipping it up and be able to examine the pet. And these tables flip so nicely that it's something that will be easy to do. Again, it's very similar to the specialty suite in that, you know, we have the same cabinetry and the sink and the bench. I love the bench in the sense that right now we currently have chairs that a lot of dogs slip underneath to hide, or cats.
No, you can't.
You can't. And the thing is that I feel like I love them having a hiding spot, but I hate dragging them out because I feel like that's such a horrible way of like starting an exam. So this way they're able to. Yeah, they could bite you too. But this way they can't do that. They can't crawl underneath there. So it's sort of nice in that sense. It takes away their hiding option, but at least it eliminates us having to drag them out.
So this room has an exterior exit, which is really nice for a couple of situations. If you have an aggressive dog that really can't be around others, and you can just go right out. A coughing animal that you don't want to have exposing to other patients in the hospital. We can send a receptionist out here to open up the door for you. Come right in here.
Yeah.
And we have these fancy chillers, which I'm very
I didn't even know about this. What is this
These
chiller?
are little vaccine vending machines.
Oh my goodness, this is new to me. Here we go.
You like load it up and then you just pull out the vaccine you need, and they're all. So you don't have to have like a refrigerator. These were provided by one of our lovely vaccine manufacturers. They're beautiful.
Well, now I love that. That is great.
Well, now.
That is a good feature. Wow, that's exciting.
Yeah. So, and then from the other side, we showed you that nice cat waiting area. And this is one of the 2 exam rooms that feeds directly into the cat waiting area. So again, to avoid cats having to come nose to nose with a dog who wants to sniff their little carrier. They're so rude.
I know. They're so interested. They're very inquisitive, but the cats do not appreciate it.
No. So cats can come right in here and then exit out that way without ever having to interact with the dog. We can come in this way, either way. We have nice 2 doors.
Yeah.
So
Okay.
we're back here in the front, and hopefully we've confused you thoroughly with the map of the hospital. But one important thing is when you come in with your pet for an emergency situation and there's something really bad going on, and maybe your pet can't walk, we do have a direct back beeline to the ER area. So we're gonna, you're gonna be greeted, and your pet can be rushed straight back directly to the treatment area from here. So you don't have to be meandering through places or going to exam rooms. Mm-hmm. We have a laser treatment, acupuncture room, and rehab. So we have a special room set aside that's a little bit different because it doesn't have windows to allow those laser beams to hurt your eyes. We have, again, we're going to have it set up a little bit more cushy so that the acupuncture patients can kind of sit there while having their treatments done in a less stressful environment, and a light to notify people when the laser is in use. So another commonly requested feature is just to have an easier kind of checkout process. So, again, we have these desks built especially so that we can give you a little bit of privacy, and you can do your checkout just as an individual with your pet by your side, without being in kind of the main fray of the waiting space.
Yeah. And then we have the pharmacy behind the front desk here. So over here, our pharmacy will be accessible both from the treatment area and from the front desk, which is sort of a cool option.
It still is a employee-only space. Mm-hmm. We don't know exactly how we're going to set this up, but we do have the ability to have people come directly to the pharmacy for what item they need and check out. Here, our pharmacy right now is kind of a small little area, so we'll have a better ability to stock perhaps more items, but just have it be a little easier from a workflow standpoint.
Yeah. So that concludes our season finale of the podcast. We've had an awesome season
I think so.
this season. I think it's been super
were
cool.
great.
We were awesome. This was probably not as pleasurable for a lot of our audio listeners.
Right.
So we apologize for that. However, we're going to be coming back strong in September. We'll be coming to you from this new facility, and we look forward to seeing you guys there.
Yeah. So check us out. If you want to subscribe to us, you can subscribe wherever you get your podcasts, on iTunes, or is iTunes even?
It sure is.
iTunes is still there. iTunes, Google Play Store, wherever you get your podcasts. And don't come here yet. We'll pay
let you
attention
know.
on Facebook. We'll let you know when you can come to this hospital to have your pet seen.
And a big thank you to our sponsors, Ethos Veterinary Health. So we appreciate it. We hope to see you guys soon. See you in September. Have a good summer.